Okay, well, hello, everybody. Welcome to a special session on healthy lives and healthy joints, healthy life show. For those who don't know me, my name is Dr. Arinola Dada, and I help people with joint pain become pain-free and people with autoimmune disease get their immune system back on track. So enough about me. Let us talk about our guest today. We have the amazing Dr. Karleen Su. Hi, Dr. Su. And
Hello.
she is a board-certified rheumatologist. She's a very dear friend of mine and a leader in the clinical rheumatology space. But to patients, though, they know her as the co-founder of Amicus Arthritis and Osteoporosis Center. And she actually leads a lot of clinical research trials that are very important for our patients and for us to kind of start thinking about things like words like cures for rheumatologic conditions. So she's an expert at rheumatoid arthritis, lupus, psoriatic arthritis, osteoporosis, scleroderma, Sjogren's, and osteoarthritis. And she has been treating patients in the Whittier area throughout the Southeast Los Angeles for almost over a decade, Dr. Su. And so she has a passion about serving the area and nearby communities, and she sees herself practicing for many more years to come.
Mhm.
So, Dr. Su, can you tell us a little bit more about why you do what you do?
Well, I love rheumatology because the area is just fascinating. As you know, there's always these new treatments are coming out. And I think you really get to know the patient really, really well over time. That continuity of care is really the reason I love rheumatology.
Yeah. Okay. Well, good. So, today we wanted to do something a little different, right? So, we thought we would kind of do a little bit of role playing too,
Mhm.
where, what to expect, when you're kind of coming to see your rheumatologist for the first time. So, Dr. Sue is going to be your rheumatologist, and I am going to be kind of coming in for the first time. And so, we're going to role play a little bit and let's see if we can maybe answer some questions for patients. So let's assume that I've been referred by my primary care doctor and I'm going to see a rheumatologist. Usually it's because they did some kind of blood test, or maybe I have a swollen joint or something, right? Or maybe they did a blood test because I said, hey, I have a family history of a condition. So, Dr. Sue, can you tell us kind of, where, other than, calm down the anxiety, where do we start? Because now you have this paper in front of you. Go see Dr. Karleen Su, rheumatologist.
Yeah, so I mean, first of all, I think it's always good to take initiatives to go ahead and call the office to schedule the appointment. Sometimes you're waiting for the office to call you to schedule the appointment, but if you really want to see the rheumatologist, go ahead and pick up that phone and make an appointment. And sometimes explaining to the staff what you're dealing with and that you have hot swollen joints, that could sometimes help them triage how soon the doctor could see you. A lot of times you may encounter situations where the rheumatology office is booked, but how you tell the story really sometimes could impact how they could, how soon they could see you.
Yeah, that is so true, right? So, if you say, oh, and so understanding why, and so maybe even asking questions of your primary care doctor that makes the referral and say, what is the reason? Because sometimes people show up in your clinic, I'm sure, and don't even remember why they were referred, right? Does
Yes.
that happen?
Yes, yes. And so it's really important to ask your doctor when they're referring you, like, what is the reason I'm seeing a rheumatologist? I know some of you may not even heard of what rheumatologist does. And so you may be referred for osteoporosis and you're like, that's not a joint. What is that? So ask your doctor, why am I being seen by a rheumatologist? And I think once you are getting that referral, I think it's important to start keeping like a little booklet of diary of what things have been done for that condition. Because it's possible that your primary care doctor, whoever referred you, may have a snippet of your history. And so you should jot some down information so you have that ready when you see your rheumatologist. For example, if you're coming in for osteoporosis, write down what you've been treated with. When were you diagnosed with osteoporosis? Because that could really make the visit much more effective and useful for your rheumatologist instead of like spending a lot of time trying to figure out that information. If you think of those information ahead of time, it would be really, really useful.
Yeah, and that is exactly true because there's some of those medications we kind of think about how long we could use them for. So if you actually come in with, oh, I've been on that medication already for, X number of years, then it helps us kind of identify what you've even tried and failed in the past so that we don't go back and repeat things that have not been effective for you. So
Mhm.
that is so important.
Yeah. So yeah, like you don't want to reinvent the wheel.
Yeah.
And same thing with rheumatoid arthritis. I know these days there's so many medications and you may not remember what you were treated. During that time when you're waiting for an appointment, it may be helpful to try to get those records and help them be faxed to the new rheumatologist. Because again, we don't want to treat you with the same medication that really wasn't effective before. It would just be a
Yeah.
waste of your time and everyone's time.
Yeah, that is so helpful. And so then do you have any thoughts about like how soon do you want the records, right? And do you look at those records before the patient gets there, would you say?
I think it's very helpful for my staff because they prepared a chart for me. And so they've already categorized the records for me. So when I go in, I could really easily go through the chart much more quickly than you bring a stack of paper at the time that you show up. Because then that
Yeah,
means I'm sitting in the room flipping, trying to find pertinent information. And so I
yeah,
think if you could fax that information at least several days before, preferably earlier than that, that would be very helpful for us. But
yeah.
if you can't, at least bring something. That's better than nothing, coming in empty-handed and with nothing in chart.
Yeah, yeah, and the other thing is, patients have been to doctors' offices where they were told that the doctor was going to fax or send the information ahead of time, and then they are shocked, and then they find out that it wasn't sent. Any thoughts about how patients should handle those situations, maybe proactively?
Yeah, so when you are making that phone call to make an appointment, or when the office reaches to you, I think it's very important to tell them the names of the doctors that you've seen before. And we will, track those records down. A lot of times it's effective, but sometimes they want a signed medical release from us. And so it's
Hmm.
actually helpful for you to call them, those doctors that you've seen, and release those medical records and give them
Yeah,
the phone number, our fax number for our office fax
yeah,
number, for example, and
yeah,
have those faxed to us.
yeah. What about a thought? I think I've had patients, oh, I'm supposed to be pretending to be the patient. So, okay, doc, I don't want to give you my last doctor's information because I don't want it to bias your diagnosis. Any thoughts about that?
That's okay. I don't need to know the diagnosis. I think to me, I just need to know the lab results and the medication you tried.
Yeah,
And so if you
yeah,
don't want to bring a note, that's fine.
yeah,
So I think the lab results, it
yeah,
will be helpful so we're not having to
yeah,
repeat things.
yeah,
Some things are not, you don't need to repeat certain things, but
yeah.
at least it helps me create a better treatment plan and diagnostic plan
Plan.
for you.
Yeah. Do you think that happens often though? Do you feel like you are necessarily biased towards a diagnosis if you get to see kind of a previous doctor's diagnosis? Does it help, hurt, or doesn't really matter?
I think it could go both ways. And
Yeah.
the reason is this, when the last doctor uh, saw the patient, that patient might have different physical exam findings.
Mm-hmm.
And so in that situation is actually helpful.
Yes.
That rheumatologist saw your swollen joints, but by the time
Yeah.
he came to me, those swollen joints were no longer there.
Yeah.
So I think it's helpful. I don't think, I think every doctor tries to make their own diagnosis and their
Yeah.
own, you know, trying to put it, it's like a detective work, right?
Yeah.
And a lot of
Exactly.
times, by the time you see the second, third, and fourth rheumatologist, you have more pieces to the puzzle. And so
Yeah.
it's not that the fourth doctor's better, the third doctor's better. They just have more
Yeah.
information.
Yeah. And I think sometimes patients, their condition is also morphing into something. And so it's also changing, right? So sometimes by the time doctor number four sees, it's totally different or is now fully manifested itself
True.
compared to when doctor number one saw.
Yeah.
Okay. Okay. So we talked about medical records. Can we talk a little bit about anxiety provoking labs?
Don't Google.
Yeah.
That's, yeah, I've had patients that walked in crying, saying that I had positive ANA, and then they thought
Yeah.
that was the end. And I have to
Yeah.
say, just, our rheumatologic conditions are very complicated. And so when you Google things, you just can't, you don't know what's correct out there. And so
Yeah.
come and we'll explain to you, what that results mean.
Yeah, there's so many, there's so much on Dr. Google out there, right?
Yeah.
And yeah, so and so I think even, the ANA test, that's a very common one that people will come in with.
Mhm.
And the other one would be like a rheumatoid factor test, right? Any
Exactly.
thoughts about the reliability? I think those are the two most notorious tests that people come in with and are so scared that they have either lupus for ANA or
Mhm.
positive rheumatoid factor. Any thoughts about kind of the reliability of those tests? Like how certain is it when you look at that lab test without looking at the patient? Would you say, oh, I know for sure you have lupus?
Yeah, so
I
you
know
have
for
a
sure.
very, very high titer of those serologies, what we call them, but you may not be manifesting any of the disease at that point. So I tell patients kind of like, you may have a genetic marker for something, but you don't manifest the disease. And so it's just a marker. You may be at higher risk for it. So
Yeah,
there's nothing to treat if you don't actually have the active disease. And
yeah,
so this is why you have to come and see us. And you may have pain and a positive rheumatoid factor, and we have to tease that out because it could be a trigger finger that's completely
yeah,
unrelated to rheumatoid arthritis.
yeah,
And so,
yes,
so just keep an open mind and don't think, oh, I have rheumatoid arthritis and that's all I have, because then you're not
yeah,
going to be able to listen to your doctor telling you what you may actually have.
yeah, yeah. So the other thing, so we've kind of talked about, patient hasn't walked in the door yet, and then they walk in the door. What do I expect when I see you though as a patient? What's the exam like? What's the visit like?
Mhm. Well, so before the visit, if the office gives you forms to fill out, it would be great if you fill out that form. It asks you for your past medical history, your surgeries, your family history, what symptoms you've had. And so I think it's really important to try to fill that information out beforehand. Be there 30 minutes before because you are a new patient. And so by the time that if you're there right at the time of your appointment, you're going to push everyone back after you because we really want to spend as much time with you as possible. And so, expect a longer time for the nursing and the medical assistant to take information from you and be patient with them because they really want to capture as much information from you to prepare you for the new visit.
Yeah. Yeah. And so actually while we're thinking about, compiling that information, sometimes people leave a lot of things blank on that form, right? Any thoughts about, are you trying to collect unnecessary information? Why do you need it? Why do you want to know about my sister, my uncle, my aunt, my mom? Why do you want to know all this stuff?
Well, with rheumatologic conditions, sometimes certain conditions that your relatives have can affect how we diagnose you.
Yeah.
For example, psoriatic arthritis, right?
Yeah.
If your
Mm-hmm.
father has psoriasis, that may affect how we think about your swollen finger, for example. Yeah.
Yeah.
So the more information you have, the more helpful it is. It may be completely irrelevant, and that's okay. We're trained to look at information, lots of information quickly, and be able to decide what's relevant and what's not.
Yeah. Okay. So the more information, it seems like more is better. We'd rather you just kind of share. You'd rather we share the information with you and then we can tease out. I think your rheumatologist can kind of tease out what's important, sounds like.
Exactly. And I think
Mm,
what I find extremely important on my new patient form, we have a checklist of all the medications you've been on for pain. And I think that's extremely important to me. Just like when we talked about osteoporosis, rheumatoid arthritis, right? You're
yeah.
like, okay, have I tried ibuprofen, naproxen, meloxicam, all those medication. If you try them, just write them down and say whether they were effective or not. Oh,
Yeah.
another thing I should mention is please, to me, I prefer that patient bring all their bottles that they're taking. And it's actually helpful for me if they bring bottles, empty bottles of medication they're not taking,
Yeah.
because they may not remember the name, and just
Yes.
two different bags and say, I tried these did not
They're
work for
not
me, and
effective.
I'm taking these. I could look through the bottles very quickly and say, oh, okay, I
Okay.
can see, yeah.
Yeah. Yeah.
And the
That's yeah.
dosage too, because a lot of
Yeah.
times you're not going to remember the dosage. You may say,
Yeah.
oh, I think this, methotrexate, I'm taking rheumatoid arthritis, it wasn't working. It turned out you were only taking 4 a week.
Yeah.
Actually optimize that.
Yeah, yeah, that's so important. So I like the idea. And for those who can't bring their medications, take a picture on your smartphone, right?
That's true.
But take everything. So take pictures, bring the medications in because it's actually very difficult to remember those medications if you've been through so many of them. But we are so used to those medications that it's easy for us to kind of run through the list and figure out what's what. And yeah, you're so right about the dose too. Yeah, a lot of times people remember the one with the methotrexate, but nobody remembers the dose. And then we
Yeah.
start talking about how many tablets and, was it a shot? Was it a pill? That kind of thing. So that's so helpful. Okay. So we've come into we've kind of filled our forms, right? And now you're sitting down. I guess you've been roomed. So the MA has called you into the room. What next?
Also, when the history taking part is probably going to be a huge chunk of time.
Yeah.
And so there'll be a lot of questions about, what your symptoms are, when it started, what you've tried that made it better or worse. And the doctor will go through the form that you fill out and may pick out things that are pertinent and ask additional information, questions about those information that you put on the form, just to kind of get a better picture of what's going on. For us, we are very thorough. We may even look at your scalp and see what's going on
Yes.
there. We'll
Yes.
look
Yeah.
inside your mouth to see if there's ulcers. We could
Yeah.
feel your neck to see if there's, any lumps or bumps.
Yeah.
We actually even we may be the only doctor that feel your fingers. Like, why are you
Yeah.
touching my fingers, every little joint? They may flip your hand over and kind of look at what's on
Yeah.
your palms because we
Yeah.
actually could tell, right? A lot
Yeah. Yeah.
findings on the palms.
Yes.
And we listen to your heart and lungs. So it really depends on what they're looking for, right? But for a lot of our rheumatologic conditions where we're talking about systemic condition, I do a very thorough exam, especially the first time. The follow-up visits may be more targeted. But if
Yes.
you're there for osteoporosis, we may not do such extensive exam because it's not relevant. But
Yes.
I may feel your spine to
Yes.
see, if there's any tender spot, right?
Yes.
Have back pain, could that be an indication of fracture? Or it could just
Yes.
be your regular old back pain, right? So
Yes.
there's ways that we could tease out that more information about your
Yeah.
back pain.
Yeah, that is so true. Yeah, my patients are usually not delighted when I have them take off their shoes and socks. And they're like, I haven't had a pedicure. I'm like, don't worry, I've seen worse.
Or I haven't shaved my legs,
I
right?
would say, oh yeah, I get that all
Or
the time. I'm like, we're not here for that. This, like,
or my feet
I'm
stink,
not,
right?
I'm like, don't worry, I've smelled worse. It's all okay. I'm looking for something specific, which is important for the diagnosis. So
Yeah,
yeah, so be prepared for your shoes and socks to be taken off when you're seeing a rheumatologist. Because we're looking at your nails, we're looking at your toes. We want to make sure there's no swollen little sausage toe going on there.
yeah.
So yeah, so I think it helps. And a lot of people come in, they said, I came here for elbow pain. Why are you looking at my feet? I'm like,
Because we're looking for something else that could be manifesting in other joints, right?
joints.
And often I have them take off shoes and socks on both feet because it
Yes.
really, sometimes you have very subtle swelling,
Yes.
and you can't really tell unless you compare it to the other foot. It's something very, very subtle, right? And
You're
it's
right.
slight warmth. I'll touch the skin on both sides and I could detect some warmth more on one side than the other, right?
Yeah. Yeah.
Yeah.
So
And
when you
also leg swelling. People are like,
yes.
why are you pressing on my shin for?
Yes.
And so that's to help us figure out if you have any sort of they call it edema, which could
Yes.
it could represent a couple different things. It could be a
Yes.
heart condition, a lung condition,
Yes.
a liver condition, or,
Yes.
venous insufficiency, right?
Yes.
Yeah.
Yeah. Yeah. Yeah. Yeah. A lot goes on to into that examination, and people
Yeah.
are wondering, why are you looking behind my ears? I'm like, well, there's stuff out there.
Yeah.
So cool. And then so we went through exam. Any other interesting, like, so I know that, we're always interested in the gut. And people are like, I came in here for joint pains. Why are you asking me about my bowels? Any thoughts on that?
Well, I think it depends on what the rheumatologist is suspecting as a
Yeah.
diagnosis. So there are
Hmm.
some inflammatory conditions that could affect the guts, right?
Yes.
And so if that question comes up, it's because we're a multi-systemic
Yes.
specialty, right?
Yeah,
Yeah,
exactly.
yeah. You're like, yeah,
Yeah.
why do you care if I have diarrhea or lose stools,
Yeah.
blood in my bowel, right? Yeah,
Yeah. A lot. There's a lot.
exactly.
There's a lot riding on that,
Yeah.
right?
Or like, why do you care if I have shortness of breath? I have joint
Mm.
pain. Why do you even listen to my lungs? right? Well, it's
Yeah.
because rheumatoid
Mm.
arthritis, there's a common, manifestation of lung diseases.
Yeah,
Yeah.
exactly. So setting expectations, and so when people come in, they've been waiting for a number of weeks to get into most of us, at least, right? And they're like, okay, fine, today I'm going to get my diagnosis and I'm going to get better.
Uh-huh. Yeah.
Thoughts on that?
Yeah, that is quite rare, to be honest,
Yeah.
unless it's your
Mhm.
simple trigger finger. That one we could diagnose very easily.
Yes.
Or osteoporosis, we have your bone density, we could diagnose that very easily. And so a lot of times we are looking for more clues. And
Yes.
so if you brought records that, and you are a good historian, we
Yes.
may be able to make a diagnosis pretty easly.
Yes.
But a lot of times we are missing information. We often have to order more tests,
Yes.
more imaging or whatnot. And even
Yes.
after that, you come back, we may
Yes.
have, a little bit more information we need. So
Yeah.
be patient. We don't always have the answer the first visit,
Yeah.
but you're in the
Yeah.
right, in the right track, right?
Yeah, yeah, and we've always been. I think our specialty has always been known as kind of the detectives,
Mhm.
right? And so a lot of things that other specialties may not fully understand, we can most likely figure it out or at least help you so that by the time you leave your rheumatologist office, if you don't have a rheumatologic condition, you would definitely be headed in the right direction as to how to get some solutions to what's been ailing you. Any thoughts on that?
Yeah, but I do want to also mention that some conditions do not require such extensive workup and
Yeah.
testing. And so I think those of you who go to your rheumatologist and say, why aren't there no labs ordered?
Mm,
Because so giving you that example of trigger finger, it's a very
yes.
easy diagnosis to make.
Yeah.
We know what it is. We do physical exam. We could refer you to occupational therapy or do a cortisone injection. That's it. There's no need to get an x-ray for that, right? And so
Yes.
don't feel like, oh, my rheumatologist is not doing, his or her job because she didn't order these tests. And
Mm,
sometimes it could be that those tests have already been done before and there's no
yeah.
need to,
Yeah.
repeat those.
Yeah.
It's not
Yeah.
necessary.
Yeah. Yeah. So I think the rule of thumb is that when you get to the rheumatologist office, they may order a bunch of tests. They
Mhm.
may order no tests, and they may order tests in between. So really, it's not a one size fits all, is what I'm gathering, Dr. Sue.
Yeah, and I could give you a lot of examples where they come in with arthritis of the knee, let's say. And it's clear that it's degenerative arthritis, osteoarthritis. And to me,
Osteoarthritis. Mhm.
there's really no additional thing. We do the physical exam tells me, what it is. We talk about treatment, and then two
Yeah.
visits later, all of a sudden they have a swollen wrist.
Mm,
So, a lot of times the initial diagnosis, may not be, the same diagnosis that you may have down the line involving other joints.
yeah. I think that's what we were saying, how things can morph, your presentation can change. And you may
Exactly.
have more than two things going on. I
Yeah.
tell my patients, if you're over 50, you're entitled to some wear and tear in your joints. And that
Yes.
can be plus X, right? Plus anything else, right? So
Yeah.
many blessings.
Yeah.
Yes.
I mean, so just like it wasn't like you're misdiagnosed, right?
Yeah, no, it's not exactly. It's not
Yeah.
that you're misdiagnosed. And yeah. And just for example, I think I had one of the attendants that taught me, who's very very smart, you know and I see a patient, like, 10 years after I've left, and that person says, oh, patient comes, and I'm like, oh, you have ankylosing spondylitis or something, and he's like, oh, that, I saw this doctor, and that doctor miss. I said, well, you didn't present, because I know he taught me all about ankylosing spondylitis, so I know he knows. So I like, your presentation at that time did not warrant this diagnosis, because things were changing. But now it's morphed into something. So 10 years later, yeah, I know that if I call him up, he'll say yes, right? But back then, your immune system was kind of in flux, is how I like to. Any thoughts to how to kind of explain to people how their disease can change? How do you explain it to them?
Well, like you mentioned, the disease may have different stages of progression. And so we are getting that snapshot when they come and see us. And this is
Yes,
why it's important for them to, come for follow-up if their disease is
yes,
still active. Once
yes,
they stabilize, doesn't mean that they could just go off and, like not come back, right? Especially if they're on
yes,
treatment. A lot of
yes,
times, they could all of a sudden the treatment's not effective anymore. So it's
Yeah.
important that we keep an eye on, on your condition,
Yeah.
and return on a regular basis.
Yeah, yeah, so true. Okay, so I think we've gone through everything, including kind of, you've done your, and now we've also set expectations. So likely you get some blood tests and x-rays. And then what's typically like a follow-up type of, how do you do it in your office? Do you
Hmm.
call them and do you have them follow up? How does that work?
Yeah, so that depends on the condition. So
Okay.
let's say it is trigger finger.
Yes.
Give that
You love
example.
trigger finger. You love trigger finger.
Because it's so easy to understand, right? You do an
Yeah.
injection,
Mm-hmm.
it should get better within a couple weeks. There's
Yes.
no need to see that patient unless
Yes.
that patient has recurrence. So I may say,
Yes.
come back in 3 months. Let's see how it
Yes.
goes. If
Yes.
it's not getting better, give me a call in a couple weeks.
Okay.
That's different from someone who has a very active arthritis, inflammatory arthritis, and we're not sure if it's rheumatoid arthritis or psoriatic arthritis. And sometimes they don't come by the textbook picture, right? And so
Yeah.
in this situation, I forgot to mention that a lot of times we may give diagnostic treatment, right?
Yes.
And we can
Mm-hmm.
figure out how they respond to a short
Yes.
prednisone.
Yes.
And this is especially hard in patients where they have fibromyalgia and
Mm-hmm.
arthritis. Maybe there's a little
Yes.
swelling here and there, and
Yeah.
we can't always see all the swelling in the fingers, right?
Yeah.
And so giving a course of prednisone or other diagnostic type of treatment could help us cinch that diagnosis
Okay.
sometimes.
Okay.
So
So you actually brought up, so some patients may have fibromyalgia and some people may have a diff. So how does the prednisone help
yeah,
exactly?
so if you have fibromyalgia, the prednisone shouldn't help with your pain. Uh,
Okay.
Although, some people do just feel more energetic on prednisone,
Yeah.
but
Yeah.
that's not the same as, having this really significant improvement in your joint
Yeah.
swelling and pain,
Okay.
from the
Okay.
prednisone. Yeah.
Okay. Okay. Well, great. Okay. Yeah, so I think that we've kind of gone through the process. You've gotten referred, you got your information, you filled your forms, you know what to expect. You're going to come in early so that we can have enough time and then expect a little history and just be willing to give the information, knowing that you're a rheumatologist can really scan through things. The earlier you send the information in, the better. You know that you may be getting some tests after, and that you may not necessarily live with a diagnosis, but you're closer towards an answer than before you walked into the office. Can I say that, Dr. Sue?
Yes, yes, yes. I think thinking ahead of time about your condition, is really, really helpful before you come in. So we're not sitting
Yeah.
there thinking, well, I don't know, maybe it was 10 years ago that I started having pain in the left shoulder. Maybe it's, I think if you think about it ahead of time, that could be really
Yeah.
helpful.
That is so helpful. That is so helpful. And and we always encourage people to write things down. Write things down. Write down your questions too, because once you're in there, a lot of these questions fly out of your head. Once you're driving a block away, you remember all your questions. So if you could write down questions too,
Mhm.
I think that's so helpful. Well, so thank you so much, Dr. Karleen Su, for coming on and just spending over half an hour talking to us about kind of what to expect when you're going to your rheumatologist's office.
Mhm.
So, Dr. Su, how can people find you, work with you, find you online? How do we find?
Yeah. So you go to www.amicusarthritis.com. If you're in the LA area and you're looking for a rheumatologist, give our office a call and we'll take care of you.
Okay, wonderful. Well, thank you so much, everybody. So, if you think that this video is helpful, do like it, do share it with anybody that you think would enjoy it. Subscribe to our channel, A Healthy Joints, Healthy Life. I'm also going to put Dr. Sue's information at the bottom in our show notes. So if you're in the Los Angeles area, please look up Dr. Sue if you have any rheumatologic condition. I trust that you'll be in great hands. Thank you, everybody.
Thank
Thank you,
you.
Dr. Sue.
Thank you. Bye-bye.
Bye.